First, we will hear from Manuela Butler. She has been a home health care worker for over a decade. She currently cares for an elderly woman with dementia who needs round-the-clock care. She is a lifelong resident of Brooklyn, New York.
Good morning. My name is Manuela Butler, and I thank you for inviting me to testify today. I am a home health care worker. I am a member of District Council 1707, Local 389, which is part of the American Federation of State, County, Municipal Employees. For the past 17 years, I have been a home health care worker. It's physically demanding, dirty, difficult, emotionally challenging, but it could be satisfying. I have been deeply touched by all the people that whom I have worked and cared for. I am proud of my work. For the past decade, I have worked with a woman who have dementia and diabetes. Mrs. G is 92 years old. I have seen the progress of dementia. It taken away memories. I'm nervous.
Don't be nervous, we're nice.
Okay. It takes away the ability to perform basic activities of daily life. Mrs. G can no longer walk, sit up, bathe herself, cook, feed herself, or clean her house, dress herself, shop for food, or even use the toilet. But because of what I do for Mrs. G, 42 hours a week, for 8 in the morning and to 8 at night, she could live in her home. She's still the queen of her castle. Dementia can change a person, but it will never take away Mrs. G's humanity. Because my work preserves her independence. What I do as a home health care worker helps Mrs. G keep her dignity. Mrs. G cannot sit up. She spends most of her time in bed. I bathe her each morning, cook her breakfast. I also prepare her lunch and dinner. I ask her what she would like to eat because like she is in a restaurant. It is a little thing that can maintain independence. Because Mrs. G is in bed most of the day, we must be very careful to prevent pressure sores. Using a mat, a drawer sheet, I move her every 2 hours. Wash her bottom, change her diaper. I also lift her and move her to be showered. I do her laundry, shop for her food, update the visiting nurse and Mrs. G's family. Even though I regularly work more than 40 hours a week, I do not get overtime pay. Oh, God. Home care work can be dirty, difficult, but at times it could be also dangerous. The past April, Sandy John Paul Bride, a home care worker in my local union, was tragically killed on the job. A mentally ill family member shot her and her client and his family. This young woman was greatly missed by all who knew her. My local union and council are establishing a trust fund for her children. Under my current job, unlike my current job, the agency I worked with before did not have a union. As my old agency, I had no pay leave, no health insurance, and no pension. Thanks to AFNI, I now can take a day off with pay if I am sick. I have health insurance. I have a pension plan. I am paid $9.40 an hour during the week and $11 an hour during the weekends. If the woman that worked the night shift do not come in, I have to work through the night. I will get straight time pay, no time and a half. Under the Fair Labor Standards Act, I will get time and a half for my overtime for doing the same thing for Mrs. G if she were in a nursing home. Because of my work, she could stay in her home, but I am deprived of overtime pay. That's just wrong and unfair. The Fair Home Health Aid Act will protect workers like me who are not covered by the overtime. minimum wage protection under the Fair Labor Standards Act. Okay. In a few months, I will be 65 years old. I don't know when I will be able to retire. I cannot afford to retire. The work I do for Mrs. G is important for the dignity and independence of persons with disability. Home health care workers should be respected, valued. Passing the H.R. 3582 is a good beginning. This year, you raised the minimum wage. Thank you. This increase was long overdue. Now you must help home care workers work with overtime pay. I urge you to pass the Fair Home Care Act.